Here are a few safety reminders related to moving the bed. First, do not use the product if it has dirty, damaged, or missing parts. Make sure the casters and brakes operate correctly. Check that all the casters are in firm contact with the floor and that the unit is stable as part of your pre-use checkout procedure. Before using the warmer with a patient, test the brakes. Are they working correctly? Lock them to make sure they hold the device in place, and release to make sure the bed moves smoothly. If there is damage or items are not working properly, do not use the warmer and contact authorized service personnel. If your warmer has an elevating base, make sure the height adjusts to lift and lower the bed. It should do this smoothly. Test the pedals on each side of the bed. Ensure the tilt is working correctly in both Trendelenburg and reverse Trendelenburg position. It's important to check that this function is working correctly. Remember, when you tilt the bed after use, it should be returned to a level position again. You can verify its level with the built-in level on the side of your bed. When in use, watch out for tension on tubing and leads. Carefully monitor before, during, and after adjusting the bed. Your warmer has an optional UPS. It is intended for backup power when the unit loses power or needs to be unplugged for intra-hospital transport. The UPS is mounted under the bed, so keep that in mind when lowering the bed. Remember to ensure that there is space between the bed and the UPS. One other point about the UPS: frequent incomplete charge cycles can decrease the battery life. For optimal battery life, charge the batteries for 6 hours to get 80% capacity, or 24 hours to get a fully charged battery. Every 2 years, the battery should be replaced. It is also important to use the patient restraints before you move the patient in the warmer. Make sure the patient restraints do not interfere with patient care or with other patient-connected devices like ECG leads, SpO2 probes, or respiratory tubing. Lower the bedside panels and ensure the baby is contained. Pull out the X-ray tray. Put the patient restraints through the X-ray slot. Be sure not to put them below the mattress. Secure the restraint around the patient, leaving space for about 2 fingers. Put the X-ray tray back into place and secure the bedside panels in a locked vertical position. Never place a patient on the X-ray tray. Remember to also secure equipment to the shelf and fold in any shelves attached to the unit before transport. The bed should be lowered and not tilted prior to moving a patient in the warmer. You'll want to make sure you can clear doorways or any other obstacle that could collide with the heater head. And remember, when you move a patient in the device, you should continuously monitor the patient's temperature and vital signs.